everybody. Good afternoon. Welcome if you're watching me live or if you're catching the replay. I'm so glad you joined me today. My name is Bonnie Barclay. I'm a therapist in Knoxville, Tennessee, and owner of Creekside Counseling and Wellness. And pretty much every Tuesday I'm trying to get on here and do just a brief bit on trauma. And today we're going to be doing a talk on recognizing trauma symptoms. And I think this is such an important part, not only for someone who may have experienced trauma, but also someone who may be in a relationship with someone who has. So according to the National Center for PTSD, it's estimated that 7 to 8% of the U.S. population will have PTSD in their lifetime. Again, why this is such an important issue. Now, while many of my clients meet the full criteria for a formal diagnosis of post-traumatic stress disorder, not all of them do, and it is not required to seek help. As a matter of fact, many can benefit from early therapy, early intervention when they've experienced a traumatic event to prevent PTSD from developing. So let's kind of jump in on the symptoms. There are 3 primary areas of trauma-based symptoms. They include intrusive symptoms, avoidant symptoms, and hyper-arousal symptoms. And these are the main areas that are associated with that diagnosis of PTSD. So intrusive symptoms. These are the symptoms that usually bring clients in for treatment. These symptoms are related to re-experiencing the traumatic event, and they can include all of these or just some of them. So the first one is experiencing intrusive images. And what I want to say about this is that keyword intrusive. A lot of people talk about, well, this happened in the past, and their spouses might or loved ones might be confused because this is in the past, and wanting clients to really be able to have tools to make this not happen. And that's the key word here is intrusive. So intrusive images are like snapshots of what happened, bits and pieces that might pop up and intrude in your mind. Intrusive sensory experiences. So for example, if someone was in a fire, just the smell of smoke might be a trigger for someone to re-experience. Intrusive negative thoughts, this idea of I'm gonna die. Body sensations, where the same body sensations that they experienced during the trauma may come up with a trigger. The sweating, the heart racing. And so when the body is really re-experiencing that trauma physically, it can be very alarming and upsetting to the individual. Intrusive and debilitating emotions, that fear, shame, nightmares, flashbacks. And this is the one that can really also make people feel really crazy. This can involve smelling, hearing, seeing, experiencing something that isn't actually there or is not actually happening in the moment. And this can hit survivors suddenly as they are going throughout their day and they are all of a sudden re-experiencing the trauma. And I'll play this out with a couple of other ones, but for example, you can be cooking in the kitchen and someone come up behind you and grab you lovingly, but the body response of someone coming up behind you can trigger an assault, a robbery, a sexual assault. So all of those things, your body can get really confused when that touch feels familiar and scary all of a sudden. This can all be very disorienting. Survivors can lose their grounding and orientation to the present moment. This can leave clients feeling overwhelmed and powerless, and others unsure of what is happening and how to help. This can often happen during sexual experiences with sex abuse survivors, where everything is going just fine, and then they're triggered and overwhelmed in re-experiencing a previous sexual assault. So this can lead to avoidance of people, places, and things that trigger those intrusions. Most trauma survivors work hard to push the trauma and everything associated away, so these intrusive symptoms are extremely frightening. So let's look at avoidance symptoms a little bit more. This is a hard one. I've talked about this in other lives with other anxiety disorders and situations. Our brain does not always give us the best information, and for trauma survivors, it can be hard to know sometimes if the avoidance is adaptive or misinformed. It makes sense that we would want to avoid the people, places, and situations that make us anxious or fearful, right? What if the urge to run or avoid is a fragment of an earlier memory intruding on the present moment, the past becoming present, and now, as Francine Shapiro says, running the show? This is the goal of therapy, to explore symptoms and triggers. While the brain does not always give us good information, trauma survivors also struggle with self-doubt. They don't trust others and often don't trust themselves and their instincts. Healing involves addressing symptoms, sure, but it's also about reconnecting a client with their body and restoring trust in safe others and themselves so they can learn to trust their instincts again and make sense of these symptoms. Avoidance symptoms can show up in other ways too. Mentally, for example, if a person was not able to physically get away, like a child experiencing abuse, the choice then was to shut down, pull away, or mentally check out. These may have been effective strategies at the time, but become a problem when they carry over into adulthood, negatively impacting relationships, quality of life, because of the disconnecting, fleeing, or numbing out. So the next is hyperarousal symptoms. This is when the body stays on high alert, scanning for danger. The sense of always being on edge, hyperreactive. This can be to smells, sounds, tone of voice. Often these clients are easily startled and can have difficulty sleeping, relaxing, resting, or even concentrating, because letting down that guard to their body means they are vulnerable and unsafe. The internal alarm system is stuck in high gear, and as a result, this person is often in a place of anticipatory anxiety, waiting to be criticized, hurt, abused, or abandoned. So what are some other things that kind of fold in and go with this? Emotional and behavioral dysregulation, relational dysregulation, difficulty trusting and maintaining key relationships, somatic dysregulation. The stress hormone contributes to many physical ailments, and so many survivors experience a variety of medical or physical problems. Research shows that trauma affects all vital body systems. Attentional dysregulation, all the way to dissociation, which is the high level of checking out, negative self-concept, sense of alienation, feeling different, isolated, alone, learning not to hope or try, poor self-care, difficulty saying no or poor boundaries and limit setting. And then kind of on the opposite side of this is excessive risk-taking and promiscuity. Some people defend against fear by going towards it, not acknowledging their fear, ignoring that part of themselves, avoiding feeling numb or powerless as well. These clients can be habituated to stress, feeling uncomfortable in the absence of it now. So, with all that said, I feel the need to end with a little bit on resilience. And I want to lead off with a quote by Maya Angelou. You may not control all events that happen to you, but you can decide not to be reduced by them. She not only survived trauma, she created a magnificent life, a symbol of true resilience. And seeking help is an act of courage, and sometimes we need help to not be reduced by what has happened to us. So, what is the definition of resilience? In psychology, it's defined as the ability to adapt well in the face of significant stress, trauma, adversity, or loss. It's the capacity to bounce back and even flourish after a difficult experience. And often it can involve profound personal growth. As an EMDR therapist, I have the opportunity and privilege to witness resilience every day. I get to bear witness as clients connect with their true and authentic selves. These are the cycle breakers, the ones that come in and do the brave, hard work of healing. The hard truth is that being human means there is suffering, big and little t traumas. I wanted to review these symptoms because if you have experienced trauma and are suffering, there is help, a way forward. Recognizing these symptoms is the first step. So next time, I want to move into loving someone with a history of trauma or a diagnosis of PTSD and help those partners or friends and family get a little bit of information about how to show up in a helpful way. I hope you all have a good rest of your Tuesday afternoon. Thanks for joining me. And as always, leave a comment or send me a message if you have any questions and I can help in any way. Thanks so much. Bye.